Hi, this is Joanne Viviano here at the Columbus Dispatch in Ohio. And for the last 3.5 weeks, we've had a team that's been looking into some allegations against a local doctor who's accused of ordering excessive painkiller doses for patients in the intensive care unit. Back on January 14th, a lawsuit was filed naming the Mount Carmel Health System and the doctor, as well as a pharmacist and a nurse. And that day, as that lawsuit came out, the health system announced that they had fired a doctor, and he had been implicated in the excessive dosing of, at that time, 27 patients. We came back later and heard from the health system that they had as many as 34 patients that had been affected by this. Most of them, the doses were likely fatal. So there's been about a dozen lawsuits filed in the case. We're aware of about 15 of the patients that have been identified by lawyers. And we've talked to some of the families who are really struggling, kind of dealing with their grief over again, wondering if they made the right decisions for their family members, because these patients were all in the ICU and some of them had ended up on ventilators and had other problems. So they had removed them from care. And they're questioning whether the advice they were given to make that decision was accurate and whether they did the right thing. And there is some question from the lawyers, and the hospital is now looking into the fact, or into the possibility, that the doctor may have given, bad advice to these families. So they're trying to figure that out as well and looking into a few other things as they continue their investigation. We also have the county prosecutor's office and police here who are looking into the case, so there could be some criminal charges coming. And the hospital system is also facing some ramifications. They could potentially lose Medicare, Medicaid funding, which would mean they wouldn't be able to treat patients who receive their health care through Medicare or Medicaid. And that would be a huge, huge loss to them. It would only apply to the two hospitals where these doses are said to have happened. So we're continuing to look into it. We're trying to find a little bit more about what happened in those ICUs, who was involved, and why this might have been the case. Well, we haven't heard from the doctor yet, Dr. Husel, or any of his attorneys. And so there's been a lot of speculation in the community about why he may have done this. Was he trying to be an angel of mercy and ease pain as patients were dying? If that's the case, lawyers and experts have told us that the amount he used was just so excessively high, above what would normally be used to control pain as someone is dying or coming off a ventilator. So there are a lot of questions. We don't know his motivation. The hospital system doesn't have any indication of what his motivation was. That's what they tell us. So we're just really trying to understand what his intentions were.